Okay, I believe we can start. We are 5 minutes into our starting time. Welcome everybody to another webinar. Today we'll be discussing the topic of evidence use by parliaments during COVID. And I would like to just run through a couple of ground rules. I'd like to ask kindly that you please remain muted at all times. Please keep your videos off. All questions are welcomed. You just want to add them into the chat, and we will have a question and answer session after all the presenters have gone, and we will read out your questions to the presenters. Feel free to add the name of the speakers or presenters into your questions so we can pose the question directly to them. Please note that this webinar will be recorded, and you will find it, you will be able to find it on our website. That's twendembele.org. You will be able to find the website on there. French interpretation is available. Si vous parlez français, vous appuyez le bouton d'interprétation juste en dessous de l'écran. Yeah, and that's it for me. I would like to welcome our chair for today's webinar, Dr. Kobena Hansen. Please, if you may take over. Thank you.
Thank you, Parfait, for those kind words. And good morning to everybody if you're within the GMT zone or close to it, and good day to everybody. I think it's a pleasure to have you with us this morning or this afternoon, depending on where you are. This, I believe, is going to be an excellent discussion. As most of you are aware, since last year, almost exactly a year to date, we've all had our lives sort of like turned upside down. I mean, COVID has come to create a lot of disruption, and it's disruption both at work, at home, within the economy, within all sectors. I mean, I think nothing has been left untouched by COVID. So parliamentarians being just another, key element within society, but more so because they tend to hold the executive accountable. We felt it was important to basically discuss this topic. One, to understand what the disruption has been to them, but or to parliamentarians, but also to understand how during this time they've had to use evidence in their work. It's important because, like I said, everybody is trying to basically find ways to function within the new normal where everything is virtual, everything is online, the new normal where we all have to social distance. But the new normal also has meant that we have to be creative, right? And I guess we've seen a lot of creativity already happening, and that's been wonderful. But also, on the other side, we cannot talk about COVID. We're also talking about some of the unfortunate situations, including the over 2 million people who've lost their lives to date, and that is very important. Now, today we see that there are vaccines, and that is a plus. But also with the vaccines, we've seen some form of health nationalism take place as countries grapple with their own needs, right, to vaccinate their populations, right, before letting go of vaccines. But then also there's the discussion that, look, no one country can do it alone. So there's a need to basically spread the love around and ensure that the vaccines are available. So I guess for many of us here on the continent, thanks to the COVAX initiative, we've seen some of these being rolled out. Joining us today, we have three special speakers. So we have Senator Sylvia Kasanga from the Parliament of Kenya. Senator Kasanga also happens to be an architect by profession. So, you know, she is in Parliament, but she's an architect, and she's basically straddling different spheres even as she does her work. Next, we have Dr. Wilhelm Von Rensberg. He's a researcher with the Parliament of South Africa, but he also is a scholar and with Stellenbosch University. And then the third speaker is Honorable Evelyn Mpagi Kabule, who is the chairperson of UpNode. UpNode is the African Parliamentarians Network on Development Evaluation, which happens to be hosted by hosted at the African Development Bank. But Honorable Evelyn is also a former parliamentarian in the 9th Ugandan Parliament. So before we start, what's going to happen is that each of our speakers is going to have the floor for 10 minutes max. Some may decide to wrap it up shorter than 10 minutes, but then nobody's going to go beyond 10 minutes. Following that, we'll have a Q&A. So I'm going to plead with you that even if you have pressing questions, you kindly hold on to your questions, note them down. You can even type them into the chat box. And then once we are done with all the three speakers, then we'll go into the Q&A. So our first speaker is Senator Sylvia Kasanga, and she's going to be talking about the experience of the Kenyan Senate Ad Hoc Committee in response to the COVID-19 pandemic. Senator Kasanga, welcome, and the floor is yours.
Yeah, thank you so much, Kobina, for that introduction. And I'm really honored to be here. Twendembele, thank you very much for inviting us, and I'm happy to represent the Senate of Kenya. I was the chair of this ad hoc committee at some point. There was a previous chair, and then I happened to be later the chairperson who finished the mandate of the committee. And when COVID struck and the first COVID positive patient was announced in the country shut down immediately. The president shut down schools, and he shut down businesses, and many other things came to a standstill. But we felt as parliamentarians, because we had not been involved in some of this decision making and prior planning, we felt the need to have an ad hoc committee that would now look into the actions that were going to be taken by the national government and the county governments as well in their preparation, in their addressing the spread and the effects of COVID-19 in Kenya. So this committee was established on the 31st of March, just about a week after the first patient was announced in Kenya. The next slide. So evidentially, so that I can just go straight into answering the question that was posed to us. After formation of the committee, the first thing that we did as committee members is we invited Kenyans from all different walks of life to send us their own written submissions on how they felt we should, as a government, handle the issue of COVID. And we received about 160 submissions in total. It was quite a lot, and it all came in within a span of a week because everyone was at home, they had time. So we got a lot of submissions from all sorts of stakeholders, and we lumped these up into these 5 thematic areas of health being the key component, and the economic and financial issues, of course, macroeconomic effects of the impact of businesses, trade, and all those others. Then we looked at the social and public order and human rights. And this is mostly because of the lockdowns would mean that a lot of vulnerable groups can't access food and water. Then, of course, we are concerned about the issues of domestic abuse, mental health. We're worried about our learners who had been sent home immediately. And of course, the curfews and the restrictions of movement came with issues of high-handedness of police. Then we had to think about how to decongest the prisons and the remand facilities, which were already looking like there would be a risk towards the spread of COVID. Then, of course, we had to look at the access of food, water, and other basic commodities to different parts of the country and different parts of especially people living in urban areas and the more vulnerable people in the urban areas. We're very concerned about that. And of course, lastly is looking at the support services, and these were the cross-cutting ones. For instance, the ICT and the role that the ICT could play, for instance, in education, now that schools were closed, or in, say, for instance, in Parliament, because somehow we had to continue doing our oversight duty as Parliament, so ICT had to come in and play a key role. And of course, there was the issue of stigma, which was really big at that time. If you remember, I'm sure everyone encountered the issue of stigma, COVID being stigmatized and being used against people. So we had to look at all those in the thematic areas that you've seen underlined there. So again, one of the things that we looked at when we received the 160 submissions, we say to ourselves, okay, how have other countries handled it? It's the first time we are handling a pandemic as such in this country in our modern times. We don't have any history to look to locally. So we had to look outside, and this included now looking at what other governments have done, what other jurisdictions have done in terms of policy and legislature, sort of guide the measures that are taken to address the impacts of a pandemic. And therefore, after looking at what other governments have done, we realized that they are guided by some form of a bill or some form of bills and policies. And therefore, as a committee, we developed the Pandemic Response and Management Bill. And again, we sent out, again, to our stakeholders, looking out, of course, to our stakeholders, what do they feel? We gave them a thematic and, matrix from what we had gathered from our research, the matrix. And we had, again, 63 submissions come in to help us form this bill. And we actually finished drafting the bill. We published the bill, and the bill went through Senate and went to National Assembly. And there it ran into a few headwinds on financial issues. But that was now one key way of getting our evidence, and most of the stakeholders would send it via email, where our clerks would then receive it and disseminate it in form of matrices, which then we would look at as a committee step by step. Then we held 97 sittings in total, and these were held mostly virtually, like we are doing right now. We discovered the virtual sittings had to happen if we were going to progress any further. And out of this, we delivered 9 progress reports, and these were tabled in Parliament between April and September. Again, Parliament was having a few sittings, would have, I think, 1 sitting per week, which would run from morning to evening with very restricted number of members in the chamber. But we always got a seat as the ad hoc committee because of course, the importance of the work that we were doing and the fact that every week we had a report to table. So therefore, we had a special seat in the chamber during that period of time, and then we were able to now lay to the table of Parliament the evidence that we had gathered, and then that as for members to debate on. Then we held a further 17 sittings jointly with the Health Committee, which is actually the Standing Committee on Health, that had to look into some irregularities that we had gathered and picked out on during the course of our work. So we handed this to the Health Committee. We sat with them a little bit at the beginning of the sittings, and then we left them working on it after our mandate ended. The second way we raised evidence was through our own independent efforts as a committee. See, most of the time in our interactions with the executive and as well as with other stakeholders, you'd find that the executive most of the time will paint a very rosy picture of what is happening at the national and the county level in regards to the pandemic. So what we did is to take our own independent data, first from the first responders and frontline workers on the ground, but we would invite them for meetings just to corroborate what we are getting from the government. So we'd had these meetings where we have information and data from government, then we would get now independent data from the people on the ground, the actual frontline workers, the doctors. We had a lot of interactions with them. Next slide. And we also undertook county visits. We were allowed by the speaker actually allowed and gave us passage to be able to go to the ground in at least 5 counties to see for ourselves some of the things that were reported to have been done either at national and at county level. So for instance, where we would receive information that a certain county has put in measures like more ICU beds, and they have more staff, or they have at least paid their staff extra dues to cover them for, for the exposure to the disease. So we'd go to the ground and see, is this really happening? And we had the honor of inspecting several facilities to see for ourselves. So these meetings, there was no any other way of doing this kind of inspection, this collection of evidence, so to speak, other than to do it physically by going onto the ground. So we had a lot of observations that came out. Of course, it was now clear that although the government maybe will say that they have released certain PPEs, would go to the ground and find that they are not there. Some counties would indicate that they have functional ICU, we'll find that they are not there. Others would find that they're there. Other guidelines would find that have actually been done. So the on-site visit was a very key component to our reports when we're reporting back to Parliament as a key evidence as to what has actually happened on the ground vis-a-vis what had been reported to us. Next slide. So one of the biggest challenges in collecting some of this data is, of course, the containment measures, because now getting the car hire services and the domestic flight, this was difficult, and Parliament had to facilitate us through an expensive means, using maybe helicopters to fly us around. And because hotels were closed at that time, you'd find that we could only do day trips. You go for the day and come back, and that really added to the cost of it. But all in all, we were still able to conduct some of the visits. We only did 5 counties out of 47. So you can see we still had a lot more to do. If it were possible, if such containment measures were not there, we would have probably done a lot more. But 5 is what we could manage at that point in time. And when the funds now to fly us around were finished, then the only counties that we could do were the ones that are near Nairobi. So where we could just drive in our personal cars, go and do an inspection, and then come back. So this did greatly affect our work of evidence and, of course, oversight mandate that we usually have. But other than that, we took advantage mostly of the virtual engagement. We did it as far as we could push it in terms of collecting evidence and hearing all the different cases that were coming out. Next slide. So data analysis, of course, is the other way we did our evidence collecting. A lot of labor-related disputes, of course, were reported. Of course, the lack of PPEs, the delayed salaries of healthcare, the lack of medical insurance, not just for the healthcare workers, but also for a lot of Kenyans. COVID was not covered by a lot of our HMOs, as well as all the others relating to deployment and promotions, especially of healthcare workers. So we had now such things, and would collect data from different organizations representing these different labor groups. And then we would now meet with our counterparts in the executive and relate this data and say this data, and we'll debate with the government to see how best then to resolve some of those issues. Then we considered statements. Statements come from members of Parliament when they have a question to put from their citizens that they represent to the executive. So again, we had 11 statements that were brought specifically to our committee on issues relating, say, burials or dismissals or administrative and other financial issues, just general preparedness of the national and county structures working towards, of course, mitigating the COVID effects and the pandemic. And again, these are very critical for us because it also tells us how in touch our members of Parliament are with their people on the ground. And when statements come, they have to be given priority. It's a question that must be given priority. It would hold up everything else as we first get that answer from the executive and relay back the information to the senator, who then may come back with other supplementary questions. On the financial oversight part, where we had to look into the audits on how monies that were specific for COVID were used, both at national and county government. For this, the committee had to purely rely on the instruments that we have as a country, that is the controller of budget and the auditor general, and of course the Ministry of Health and some of the county government parliaments were able to give us some of these. Again, these were questions that we had to ask specifically to these people to come back to us and tell us how have the funds been used, and they could give us evidence and file reports and of course information and how the money went from one bank account to another to our satisfaction. So that we had to rely on the instruments that we have that have been set up by our constitution. Then to our work, of course, to a great extent is informed, of course, by data evidence, information, and the human impact stories that we received. Now, the human impact stories part of it, we did receive a lot of information from people's stories. Like for instance, when it came to the high-handedness of police during the during the lockdowns. So you would hear, real life stories from people. They would invite them in the meetings and they would speak to it, or you'd have some organizations that work with people on the ground, and then they would, collect this kind of information from people, and then they would bring it to us, to our committee. Then our team would conduct extensive research on what other governments are doing, and we would, relate this with what our government is doing. So part of our secretariat, which we had been given, their work was actually just to follow the trends of what other countries are doing. And then we'll try and mirror that here in as far as possible, of course, taking into consideration our own local challenges and our local situation. So, like even now when the conversation has shifted to new variants of the virus and on vaccination of the population, we still find ourselves in a situation where new information and data is being published every day. It's actually quite a challenge to keep up with what is new. Just in fact, as you wait for a question to be asked, to be answered by the executive, today you find that a week down the line, things have actually changed and the question that you asked may be even outdated. So that was a challenge, that everything was, completely rolling over so quickly as we were moving on. And it really forced the committee to really be on its toes. So then our mandate as a committee ended on the 1st of November. That was about 7 months. And many members would have wanted the committee to continue, but by the time, of course, we were winding up, a lot of the other committees were now already back to the House, and they were seized of the issues. And what we did is a systematic handing over of the different thematic areas to the standing committees for them now to continue with work. So then there's no really need for another ad hoc committee. But during that period, the pandemic did demonstrate how reality can evolve so fast, and that the available data and information is not up to date enough to enable effective decision making and oversight by Parliament. A lot of times, Parliament, we are forced. Actually, we are looking at things that are already past, like looking into. You can almost call it historical data, because, for instance, up to today, some of the audits that we requested from the Auditor General, the Parliament has not yet considered it. Yet these are funds that were being utilized, say, in July last year. So you can see a lot in a situation of a pandemic, things need to kind of happen a bit differently in Parliament so that evidence can be processed and looked into almost immediately if we are to really make the impact that is required. But nonetheless, I was very privileged to chair this committee towards the end, and we tabled our 9 progress reports, which were extensive and which were actually a culmination of work by the Kenyan citizens themselves, the Parliament staff, and ourselves as well. So there's clear need that our parliamentary research departments need a lot of strengthening and a lot of boosting, and not just with staff, but the access to research and data is really critical. We really struggled with looking for the research. We really struggled. So this would be critical for all our parliaments. And of course, our Senate welcomes ideas to help inform and improve the management and recovery strategy of this pandemic, which is something we are all grappling with, of course, but of course, bearing in mind that other nations ahead of us have probably been in similar situations and they know how to deal with this going forward. So thank you very much. And it's been such a great privilege for me to be able to do this presentation on this platform. Thank you.
Thank you, Sylvia. That was excellent and very informative, right? It's interesting, right, to hear how basically Kenya approached the crisis. And interesting when you say that, this was the first pandemic that you as a nation had to face, because I think for some countries, especially those that had dealt earlier with, let's say, the Ebola crisis, they yes. had something to draw lessons from. Exactly. But it's interesting to hear that now you are basically going into it, it's like, okay, this is the first time. So then you had to seek knowledge from outside to see, okay, what have others done? So what can we do?
Absolutely.
Yeah, I mean, that's it. No, okay, so that's great. I've put down some interesting points, but as we agreed, all right. So our next speaker is Dr. Wilhelm Von Rensberg, and he's going to be talking about the changing functions of Parliament during national lockdowns. As I had mentioned earlier, William is basically affiliated with the Parliament of South Africa and is also a scholar at Stellenbosch University in South Africa. William, the floor is yours.
Thank you very much, Kubena, and thanks to Mbele for this opportunity. It's really nice to be back with you guys. Like you said, I'll be looking at the functions of Parliament during COVID-19, but as we would know, the functions of parliaments didn't necessarily change. The functions stayed the same, but it's how COVID-19 affected the ability of parliaments to execute those functions. And I'll touch on that. And I must say it was a really, really interesting presentation we just received from Senator Kasanga, how Kenya approached this, this challenge that faced Parliament, and was very encouraging to hear about the establishment of the committee that she served on. That is an excellent example of a way for Parliament to continue its business. However, I want today to look at a bit broadly at parliaments in general. And the example that Senator Kasanga noted in Kenya was not the case in all countries. So I want to point out to the contradiction to that, perhaps. And I want to start by looking at what I would call the first 2 or 3 months after the lockdowns around the globe started. So in most countries around the world, we went into lockdowns, and this posed a specific challenge to parliaments. And in the practical challenge that this posed to parliaments is firstly the physical closure of parliaments, where we couldn't do the normal oversight, the debates, legislation, and so forth. A lot of countries' parliaments closed almost immediately as lockdown started, and their functions to a large extent ceased. And another reason for this was this, in some countries at least, the slow uptake of virtual platforms. And you can't blame parliaments for this necessarily. It was a brand new situation. Parliaments needed to decide how they will approach this, and setting up all the virtual platforms and those things, it takes time. But in this time of slow uptake, there was a real inactivity of parliamentary activity during this period. And this is specifically when it was most needed. It was a time of crisis. We saw, it's not only a health crisis, but we saw the deployment of the security forces in many countries. Oversight was really needed in such a period. And in many cases, parliaments were found wanting. But how did this play out? What did we see in terms of the legislative challenges to parliament's functions? We saw in a lot of countries that through the use of secondary legislation, the executives bypassed parliaments. And I want to touch on 3 examples there. First, in South Africa, for example, the Disaster Management Act was passed. And with this, the executive made regulations, and through these regulations, the lockdown in South Africa was implemented. And in the legislation, there is no room for parliament necessarily to approve or disapprove of these regulations. And this has been in place for a year now, and still there's no scope for parliament within that legislative framework to give input. Similarly, in the Philippines, for example, when the pandemic spread, their parliament passed the Heal as One Act immediately at the beginning of their lockdown, and then their parliament went into a recess, and the Heal as One Act that they passed gave significant additional powers to the executive in the spending of money and the using of security forces, etc. Similarly, in the UK, we saw the Public Health Act and regulations used by the executive. And one researcher noted that this was the largest expansion of executive power he has seen in peacetime in the UK. So the point what I want to demonstrate here is like, as we went into this lockdown period, a lot of parliaments shut down immediately, and the executive sort of gained power over parliamentary oversight, especially during those first 3 months. And then something close to my heart, perhaps just to throw in here, and Senator Kasanga also touched on this, is the securitized approach to lockdowns in many countries. This also had an implication for Parliament, because did we see parliaments actually doing proper oversight of the security forces during this time. We know of many instances where of violence against citizens of countries by our own security forces, and this happened in many countries. And the question must be asked: where was Parliament in this time? And in that period of inactivity, did Parliament not perhaps fail to actively oversee its security forces in that period? On the next slide, I would like to discuss what happened after that. And this is perhaps on a more positive note. So once Parliament's caught up with the new reality, what did we see happening? And in terms of Parliament's representation function, we saw reverting to virtual platforms that allowed for the continuation of Parliament's functioning. And this is an excellent opportunity going forward for Parliaments to make sure that in times of crisis, it still stays active and it maintains its representation function. In terms of Parliament's oversight function, the adoption of virtual platforms, for example, increased opportunities for involving external expertise in oversight. It's now very easy to call in external experts, and this has a huge implication for evidence use. We saw in South Africa and other countries that I looked at, it's easy to facilitate a meeting where you would get stakeholders and think tanks and academics from different institutions to sit in on one meeting and provide evidence to parliaments. Also then when Parliament started to catch up and became online, so to speak, we saw the timely oversight of the executive during emergencies. So as Parliament started to function normally again, Senator Kasanga spoke about Kenya, that in November the committee ceased to exist, and then after that normal committee activity resumed. And we saw this in most countries through virtual platforms or other means. Parliament got back on its feet and started to do oversight as it should. And lastly, one of the positives is transparency of parliaments. The electronic or virtual platforms increase public access to Parliament's work. Many countries, for example, now live stream their meetings on YouTube, and it's easy for the public to log in and follow these meetings and the activities of not only House debates, but committee debates. And I think that's an important distinction to make. On the next slide that you see there, I just quickly want to go through how COVID-19 actually impacted practically on the use of oversight tools by parliaments. And the agreed upon tools that parliaments use widely are parliamentary debates, parliamentary questions, oversight visits, in-depth inquiries, and using external audit. Now, the first one, in terms of parliamentary debates, initially, during that initial periods of lockdowns and inactivity of parliaments, this was stifled. But as the electronic platforms were used and other plans were made, this became active again. So parliamentary debates gained traction again. And this was very important, specifically at committee level, because committees, as we know, serve as the engine rooms of parliaments.
As we couldn't identify the facilitators.
Secondly, parliamentary questions. The poor execution, specifically in those first 3 months, there was poor execution in many countries of the use of parliamentary questions. Systems were not in place in parliaments, government departments were not functioning, so we didn't get all the right responses in terms of the use of parliamentary questions. And then the key one, and Senator Kasanga also focused on this, was the severe or oversight visits, which was severely inhibited during the lockdown. And this was mainly due to travel restrictions and the risks that MPs face in traveling during that time. And I think this is an important point. What Parliament should think about in future, if this happens again, how will we overcome this? It's an important evidence gathering tool for parliaments. So how do we overcome this when practically it's not possible to do an oversight visit? In-depth inquiries. This is an interesting one. As I noted earlier, with the use of electronic platforms, it's easy to invite a number of external role players and experts to the committees. And in that way, you can do much more in-depth, deep diving within a committee's oversight function. So this is a great opportunity, I think, going forward, and also important for evidence use by parliaments. And lastly, the use of external audits. This sort of carried on as normal. We saw in a lot of countries the auditor generals actually becoming involved in auditing of COVID-19 related expenditure. I think the question we have to ask is, to what extent has Parliament's been able to work through the auditors' analysis and audits of COVID-19 expenditure. So if we looked at, in conclusion, if we look at these two periods, your first lockdown period, where there was, in many countries, a lack of parliamentary activity, and then Parliament sort of caught up. So what do we learn from this? And I think there's two aspects. First is the risk to parliaments. The risk here is executive dominance. We saw in many countries that Parliament fell short during that first period, and through the use of secondary legislation, parliaments were sort of sidelined. And we saw the rise of executive dominance in many countries. And this is not healthy in a system of checks and balances as we have in parliamentary systems. Secondly, another risk is the limitation on the use of certain oversight tools, specifically oversight visits. And parliaments should investigate and spend time in thinking about how they can overcome these shortfalls that we experienced. Secondly, there's also opportunities for parliaments that arose. And number one is improved transparency. Any other researcher that's here today would probably agree with me that parliamentary websites are not the greatest around the world. But what we learned from what happened now was that meetings were live streamed. You can go back and access meetings on YouTube or on the websites of parliaments. So all of a sudden, this just upped the level of parliamentary transparency, which is really great for the institution of parliament and for accountability. And also, there's an opportunity to develop in-depth inquiry. And that takes us back to that the ease with which we can get external role players to report to Parliament, and also to bring in a number of experts with evidence to easily report to Parliament. And I think this is something parliaments can take forward. So going forward, how do we address this? And I think there's two things here. First is the political will be required to learn from the lockdown mistakes and strengthen parliamentary functioning. But also, we will need administrative will. Parliaments as institutions that are administrative staff in charge of parliaments need to go sit and look how they can learn from the mistakes and take this forward. So if we have the political will and the administrative will, there's a lot that we can take out of the lessons learned in this time. That's it from my side. Kubena, thank you very much. Look forward to the questions at the end.
Thank you, Wilhelm. I think it's wonderful. Very insightful findings that basically you provided. But more importantly, it seems to really have picked up well from where Senator Kasanga left off. Because then what she is saying, basically, you also have mapped it out. I mean, in terms of issues of engagement, in terms of the transparency, in terms of the availability to reach a wider stakeholder base, just because of what was made available through these tools, or even some were using not even the virtual tools, but even social media, because a lot of these were brought to the fore. And I think you capture that excellently, and it sort of lends a lot of credence to what Senator Kasanga was doing with her team in Kenya, and also what they experienced. Yes, so let's move to the last speaker, and then we'll wrap it all up, and then we open it up. So the final speaker is Honorable Evelyn Mpagi Kabule. Like I said, Honorable Evelyn is the chairperson of UpNode, the African Parliamentarians Network on Development Evaluation, and she's also a former parliamentarian in the 9th Parliament of Uganda. She's going to be speaking about the expected changes to the function and role of parliaments post-COVID. So she's going to give us a forward-looking analysis of where things are going to go. Honorable Evelyn, the floor is yours.
Thank you so much, Kobena, and I would like to thank everybody. I'd also like to thank my fellow presenters, and I would like to send on behalf of Uganda, we send our condolences to Tanzania for losing their president, despite the fight that he had put in. So I thank you all. I was asked to present on the expected changes the COVID-19 pandemic could bring to the functions and roles of Parliament, and going forward, how it's impacting parliamentarians as we try to live with a pandemic. So I'll explain how the COVID has affected the work of parliamentarians, and I'll also focus on the use of online platforms parliaments have established to conduct daily activities and debates. As a start, some steps parliaments took to enable them to apply their functioning roles. These are the key roles and functions of parliament. And these functions inevitably overlap and sometimes collide. And with the coronavirus pandemic, parliaments had to adjust their way of working, with innovative and digital solutions becoming the norm for some of the parliaments. You realize that some parliaments restricted their attendance to maintain physical distancing and lessen the risks of contagion. Thus, parliaments have the responsibility to ensure that all of the measures that have been implemented in various countries, as a result of the emergency, do not end up limiting civil liberties and access to information, and that government actions can be continuously monitored by the legislative branch and by citizens. So these are some of the steps Parliament took to enable them to apply their functioning roles. And these include innovative solutions such as the virtual sessions. However, this may impact negatively because you realize that some of the virtual sessions are affected by some issues like lack of network, where they have to get information from the villages. It may not be very feasible. So that is a challenge that some of these parliaments have been facing. Secondly, some parliaments have given governments necessary powers to protect public health. So some countries have come up with new policies giving governments or the executive powers to be able to protect government public health, and have come up with SOPs which now have become laws in some of the various parliaments or countries. The other issue is to conduct effective oversight of government actions, particularly to ensure respect for citizen rights. This has also been taken up by some of the parliaments within the continent. And then lastly, we learn lessons from the crisis to feed into better planning and decision making. So I'll go back to the first one, which is use of online platforms to meet and debate. Different country solutions like virtual plenary sessions. And you'll find that this has now affected the attendance of some of the parliamentarians, where people are not online and they may not be able to engage in debates just because of the effect some of these high-tech solutions are impacting. Then secondly, legislatures developed remote participation procedures such as teleconference question periods. And you'll find that some of these questions, the teleconference questions may have been done. Sometimes you'll find that getting responses has been not very impactful because of lack of preparation by the executives who would be able to answer. Then legislators have also been in their parliamentary offices or from home. Next slide, please. Next slide, please. There are also threats to oversight role and site visits. As already mentioned by the previous speakers, oversight as a balancing act between supporting the government in its policy responses in a time of crisis and apply the necessary checks and balances. You find that during, if you're carrying out oversight, and you may not be able to get exactly the information that you will have gotten if it was a physical visit. And some of the impact that has had for some MPs required trainings and access to use tools like laptops where issues could not be overlooked. And in some parliaments, security concerns held back the adoption of teleconferencing apps, particularly for confidential proceedings. And then the oversight during the pandemic could not be delegated. So you'll find that some of the parliamentarians who could not be able to do the virtual oversight definitely lost out on some of these representations. Okay, I was on point number 3, where we're talking about the threat to oversight role and site visits, where parliaments on the continent still play an important role in participating oversight of government actions, even during the COVID-19 pandemic. And this will be a long-term task given the still long road to recovery. And clearly, oversight during the pandemic cannot be delegated, and it is indispensable and has become extremely necessary, given that many existing structural failures have been laid bare in different countries affected by the pandemic. Legislatures faced significant challenges stemming from public health concerns, and many had to take. In times of crisis like this, Parliament have had a duty to ensure that all measures taken result in enhanced protection and support of the most vulnerable. And they've had a new role, parliaments have had a new role that entail not only collaborating with the executive branch where necessary and opposing it when required. So they have to work together. Parliament and executive this time have to work together more than before in order to be able to serve the masses despite the ongoing pandemic. And there could be no threat to the oversight role if parliamentarians continue working with the aim of ensuring transparency, accountability, honesty, ethics, and integrity in the public service. And it is important to achieve a balance in times of this crisis. And it is advisable to be supportive of the government because the situation can precisely in order to safeguard and protect citizens. MPs have had to have a critical and demanding attitude towards their respective governments. And they have to be very keen on ensuring that this crisis brings them into proper planning and structure changes. So parliaments demonstrated resilience as a conclusion in overcoming operational disruptions by adopting a wide range of solutions to continue meetings, and they adjusted their facilities to allow for in-person attendance while maintaining public health guidelines. And their use of technology to facilitate their engagement brought a plus, and as discussed in several hurdles that could not make it completely applicable. But parliaments have also demonstrated resilience by proactively implementing special oversight mechanisms.
Honorable Evelyn, you've dropped again, but I think we did get the message. Thank you very much. So those insightful points were good, and again, you know, it also goes to highlight and basically reaffirm what the two earlier speakers had spoken about. So thank you again, Honorable Evelyn. So I think, ladies and gentlemen, from what we've heard, right, it's obvious that in as much as COVID has disruptions, that within parliaments, a lot of effort, a lot of innovation, a lot of activity was going on to ensure that the function basically was upheld, that the role of parliament was upheld. Whether in the case of Kenya, it meant looking to see what people had done, so to forge a new path forward, engaging with stakeholders, going on the ground, basically to ground truth what was heard, and ensuring that, right, they were one step ahead of things. All demonstrates basically the excellent work that was being done. I guess this again was reflected in the second presentation, which basically highlights that, yes, it wasn't some of what we saw, things like the securitization of the crisis, the things like the executive dominance were not necessarily limited to Africa, but then we see this happening in many other countries. So this again was not unique to the continent. And as Honorable Evelyn also basically in his submission mentioned that, yes, parliaments, right, have tried to engage as much as possible, yes, and through the process, in as much as there's been some threats, we've also seen that there's been a whole lot of opportunity and possibilities that have come out of this. And I guess as we move into a post-COVID era, what will be good is how we basically leverage what worked, revisit what did not work, and then use that to enhance the oversight function of Parliament and also to enhance their work. Ladies and gentlemen, I think at this point, what we'll do is we'll open it up as we had agreed for questions and answers. Already some questions have come through the chat box, so I'm going to privilege those questions first, and I see more coming, and we'll try to answer as many questions as possible. For those of you who've posed your question in French, Parfait will do justice to that. I do not want to butcher your French, so I will not even attempt. So I think the first question we got was one that was directed at Senator Kasanga, right? So the question basically was, what mechanisms did your committee have at your disposal to stay abreast, you know, in light of the changing information needs? And secondly, did using virtual tools impact the quality or perspective of the voices being heard or the evidence being generated?
Yeah, thank you, Kobina, for that. And thanks again for the presenters. That was very, very insightful indeed. And yeah, what we did at committee, the clerk of Senate had given us a very able team. And because the other committees were sort of put on hold at that time, at the beginning of the pandemic, we had a lot of resources to ourselves as an ad hoc committee. So we actually had a team specifically just looking out on emerging issues globally. We had actually a team of 2 whose work was specifically to look out at what the information that is coming from the globe on what's happening in Africa, and we would keep comparing almost on a daily basis. We were working practically every day, including Saturdays and Sundays, just so that we can keep abreast with what was going on. Although I must say it was still, it wasn't easy even then. Even then it was quite a task to monitor all the trends coming from everywhere. In fact, at some point, we just had to narrow down to what Africa was doing, what South Africa is doing, and then you know, some of the countries that had dealt with. So yes, so that's what we did. And for the virtual sittings, of course, virtual sittings come with their challenges. Internet connectivity in some cases is a challenge, so you might not hear very well. Some areas just don't have internet, so we were a bit blind to certain sections of this country because we know they don't have good connectivity. In terms of the evidence, in some cases it was difficult. There's some evidence that you can't quite admit virtually. in as much as we will listen and you project, you know, your presentations and all, there's some which you really can't present, and we had to then go and do the physical, because then on virtual you can't do. For instance, like I had given you an example before, in one of the counties, they would say we have purchased 21 ICU beds, and you know, instantly when we talk to the people on the ground, virtually they would say no, those beds were actually moved from a private facility to a government facility. So when you ask the question again, you're shown receipts. The receipts are posted online during a virtual meeting, but until you go to the ground to actually see, do the beds actually exist, then you realize that admitting evidence virtually may have those challenges. But other than that, of course, we pushed it as far as we could at that time, given the circumstances.
All right. Thank you, Senator Sanga. Ladies and gentlemen, it seems that time is not on our side. I will, however, give William the floor, because there's a question that basically came to you. And if you could be kind enough to address it. Basically, the question was, I'm not too clear on the role of parliamentary questions. Can you shed light on how they work and why they are so vital? And secondly, can you elaborate a bit on what you mean by executive dominance?
Thank you, Kobena. I think the issue of parliamentary questions, it's one of a number of oversight tools that parliaments can use, and questions can either be put orally to ministers, for example, during a House sitting, or written questions can be posed to ministers. I don't know if that's the case in all parliaments, but in most parliaments that would be the norm. So in a case like COVID-19, that lockdown period, for example, where parliaments did not sit, there was no opportunity for oral questions in the House to ministers, for example. But the opportunity for written questions still remain. And if you can pose a written question to a minister, they need to respond to this, and that gives you some information from the executive, and then you can counter that through fact-checking by Parliament itself. The example that Senator Kasanga used about the beds in a hospital in a county. A member of Parliament can put a written question to the Minister of Health, for example, asking a detailed breakdown of the number of beds in hospitals and so forth. And then Parliament can hold the minister to that through, for example, oversight visits to see if that's actually the case, and match it up with the expenditure and so forth. So I think written questions, specifically when Parliament is inactive, written questions remains a tool that can be used during that time to hold the executive to account. The second question around executive dominance, this may not have been the case in all countries, but we did see it in those, for example, those countries that I mentioned, where parliaments, when COVID pandemic hit, a lot of parliaments went straight into a recess period. Yes, it was a planned recess period, but they went into this recess period, and the oversight function and holding the executive to account for that period, be it 3 weeks, a month, 2 months, 3 months in some countries, there was no counterweight to the power of the executive. And I think if you throw in with that, in many countries, the use of legislation where Parliament that is not necessarily required to approve the powers of the executive in terms of a lockdown, for example, that's where you see the creeping executive overreach in terms of their power. So Parliament is an important counterweight in the trias politica that we know. Parliament is an important counterweight to the power of the executive, and in crisis times, it's very easy for the executive to gain additional power, and it's important for parliaments to match that power in these times. And if they don't, which we saw in many countries, that's when executive dominance grows.
Thank you very much. I'm being told we don't have too much time. There's a question that was open to everyone, so maybe I will read that out, and then we see how we can respond to that, even as we try to wrap up. And the question basically is in two parts. It was, what was the role of civil society in ensuring that parliaments still play their function effectively. And then the second part is basically what role do you think Parliament as an institution plays in challenging the current trend towards executive dominance and secularization? So first has to do with what civil society did or is doing, right, to ensure that parliaments function. And then the second one is, okay, what can Parliament itself do to challenge this or to buck the trend towards executive dominance and the secularization? So I don't know who want to go first.
I can go first. All right. Now, the role of civil society is extremely critical when it comes to policy making and legislative making. And I think any prudent government would first give them some space. Any parliament, the way we function, should give space to civil society. And in fact, during this COVID time, we really relied on a lot of submissions from civil society because really their work is on the ground. They work with people. And every time we send out a call for public participation, it was the civil society groups that would come out, in fact, first in the answering our questions. And again, in raising evidence, we relied on a lot of their evidence because they're good at collecting the evidence there on the ground, and many of them are funded to do specific issues within the communities. So for us, the civil society plays a very key role in some of the work that Parliament does, that is in policy shaping, legislative making. And in fact, right now in the oversight of the ad hoc committee, we relied heavily on a lot of the evidence that they brought to us, which we admitted as evidence of the committee for us when we were questioning the government. For instance, on issues of high-handedness, say, of the police during the lockdowns and the cessation of movements. It is they who came to us and said, you know, we need to check A, B, C, D, this is happening, and these are the statistics, and this is the evidence, and they would collect the evidence, and then we would use that to question the government why all these things were happening. Same as, you know, the work of, say, Red Cross, for instance, and many other organizations. So it is very critical, and it must, any government should encourage the space of the work of the civil society groups. And when it comes to the role of parliaments, the way Wilhelm was talking about, in fact, the high-handedness of the executive was very evident here in Kenya, because when the decisions by the executive to even shut down and, you know, go into lockdowns, those were decisions that were made, in fact, hoping to include parliament. But because of the way the constitution is, the president cannot close or shut parliament in Kenya. So he has to request parliament to shut down. And we would meet and say, no, we have a mandate to oversight. What we shall do is that we shall check on the containment, we shall check on the measures, the COVID protocols, make sure we social distance, and, you know, parliament will be fumigated every other day, which will allow us then to be able to sit and to continue work. And of course, activate the virtual sittings, which even now have become a very critical part. And although we slowed down a little bit on the containment measures, now we have been put on lockdown again as we speak. And even now, Parliament, we have said, no, we are not shutting down. We are reducing on the number of sittings, but we must continue with the oversight role. And I think it is very critical that parliaments must take this, because a lot happens when we are not oversighting. A lot of things happen. And in fact, here in Kenya, we had to even encourage the county government parliaments, the legislatures that are in the counties, to also do the same thing as we did, that they can also monitor the county governments during this period. So it's a critical role for parliament to play. If you leave the executive, they will run away with it, without a doubt. Thank you.
Thank you very much, William.
I think Senator Kasanga got the gist of it. I will just add, perhaps, in terms of the role of Parliament and the securitization that we saw during the lockdowns. And the role of Parliament varies between countries. Legislation in countries differ. In some countries, parliaments have an approval role called the ex ante approval of military or large-scale police deployments in a country. So in some countries, the the executive must come to Parliament to get approval for the deployment of the security forces. Whereas in most countries, I think that is the prerogative of the executive, but Parliament has an oversight role of that. So it differs between countries, but in both those scenarios, Parliament has a role to play. Whether you approve or not, where you approve or disapprove of the deployment of, for example, your military internally, or whether you do oversight of that deployment after it's been approved, Parliament has an important role. And here, a very important role is played by your defense oversight committees. And I think something that we can take into account, especially in this time, we saw a lot of internal use of your military forces, for example. This is not the same as a country sending its troops to participate in a UN authorized mission in another country. This was the internal use to contain movement within a country. And we saw in many countries that it didn't turn out well. There was a number of people died at the hands of their own security forces. So the role of Parliament in that is continuous oversight of that deployment. Secondly, and this is a problem in a lot of countries, to ensure that that oversight process is transparent, especially where your security forces are deployed within your own country. Ensure that your parliamentary oversight of the defense and police is a transparent oversight process. And lastly, parliaments can also pass legislation for institutions such as military ombud institutions or independent police investigative organizations. So that there's an accountability mechanism where civilians can go and lodge a complaint against police or military misusing their power in a country. So parliaments have an oversight role, a legislative role to play in that, and that needs to be a transparent effort by parliaments.
Thank you very much. I think still Honorable Evelyn, unfortunately, was not able to rejoin, but at least we're glad that we did hear from her. Ladies and gentlemen, I know we promised that we'll only keep you for an hour. We've already strolled over an hour, so we don't want to keep you any much longer. I think this has been wonderful, very insightful. We really thank our presenters, Senator Sylvia Kasanga from the Parliament of Kenya, Honorable Evelyn, the chairperson of APNOD and former parliamentarian of Uganda, and Dr. Wilhelm Von Rensberg, who's affiliated with the Parliament of South Africa and is a faculty at Stellenbosch University. Ladies and gentlemen, we've benefited a lot from your insightful experience that you've shared, and I think all the people listening here will definitely agree that we've had some very informative discussions and also insights from you. Okay, Honorable Evelyn tells me she's still available. She's online. Okay, thank you. I thought you dropped off. It's great to know that you're still with us. We appreciate that. So as we did mention again, the recording is going to be put on the Twende website. I think this discussion will not end. For those of you who are aware, soon there'll be the G-Local evaluation week. And again, I think one of the panel discussions that's been put in place has to do with parliaments and the COVID experience. So hopefully we'll be able to continue this discussion there, and we're hoping that you'll all be able to join us. I apologize for not being able to take everybody's comments, but this is something that does happen. Before we sign off though, I definitely want to point, because Honorable Evelyn has basically responded, and she's pointed out that civil society organizations are critical in this crisis if the political environment is smooth. Yes, we do agree that the civil society is key, right? So again, like she points out, in Uganda, civil society did try to intervene in the parliamentary sessions, but were shut down politically. Okay, but at least they did make the effort. So again, let's continue this discussion beyond today. And then let's ensure that, because this is something that's very important, and even as we go forward, we know that we need to definitely leverage on the positives and then take those forward, like the speakers have told us. So again, thanks to everybody who joined us. Thanks to our interpreters for making this possible. And again, once more, a big thank you to our three speakers. We really appreciate you making the time of your busy schedules to join us. Thank you very much.